Everybody that's listening, we have a returning guest, the man, the myth, the legend, Thomas Hemingway M.D. It's ThomasHemingway.com, Unshakable Health with Thomas Hemingway podcast. And then the book is Preventable, 5 Powerful Practice to Avoid Disease and Build Unshakable Health. Doc, it's always a pleasure to have you on. You're a man that tells the truth. You're not like these other phony baloney doctors that are a lot of BS's, but I'm saying that I know people that have saw our previous interviews agreed with that, and we do have some audience questions, which we're kind of just going to throw around today. But thanks for coming on the program again.
Hey, Rob, man, it's a pleasure. I've always enjoyed our conversations, and I'm happy to be back. So aloha to everybody listening or watching. Let's get into it.
So let's talk about this. And this is kind of freewheeling today just because, I wanted to do something different today. And we had quite a few questions. I combined some of them together. We're talking about inflammation in the body. We're hearing a lot about that going on as far as the first topic. Can you talk about how inflammation does build up in the body and what causes this massive inflammation that a lot of people are developing rather?
Yeah, no, totally. So first of all, let's just break it down super quickly. There is acute acute inflammation, which happens on purpose to save our life. You fall down, you skin your knee, you need the blood cells to rush to that area to help coagulate, the injury, and also immune cells to fight any bacterial invaders that happen to be at the site. Or if you get sick with any kind of bacterial or viral illness, you have acute inflammation happening right now to take care of that urgent situation. That's what we like to see. That's normal. That is not pathologic. What is pathologic or not good for us is ongoing, day after day, chronic inflammation. Chronic inflammation is the stuff that literally, it's like kind of a background level smoldering fire that never gets put out. So what is interesting about inflammation is now we are understanding this much, much better than we used to. But basically, almost every disease you can think of that humans might get has a component of inflammation. For example, heart disease is primarily an inflammatory illness. Cancer, an inflammatory illness. Even, thank goodness, we've finally gotten this through our thick skulls, that even all sorts of mental illnesses, brain, what I like to call brain health challenges, everything from anxiety to depression to full-blown, ADHD, schizophrenia, all of these are inflammation happening in the brain. And so what's cool to kind of take a step back is just think about, all right, all of these diseases that we're exposed to and could get as humans have a similar component, which makes them sort of noticeable to us. Basically, we have symptoms when we have inflammation. And so rather than, for example, just take an antidepressant for depression or a cholesterol pill for elevated cholesterol, or rather than take, one of these very targeted, what I like to call the Band-Aid approach to medicine, if you will, it is better to attack the underlying, go a little deeper in what is the cause of that disorder in the first place. Where is the inflammation coming from? What is causing the inflammation? And to tackle that a couple layers deeper, because it's super easy to just mask the symptoms, right? You go into your doctor, they check your blood pressure, they say, oh, your blood pressure is a little bit high. Let's just give you a blood pressure pill. They didn't ask you about your diet. They didn't ask you about your sleep. They didn't ask you about what your daily food intake looks like. Like, what are you eating? There's all sorts of factors that play in to, example, high blood pressure. There's one type that is primarily hereditary, but 90% of the other issues with elevated blood pressure have other potential background causes, whether it be diet or lack thereof of a good diet, or movement or lack thereof of good movement, or stress or lack of sleep. Like, there's all these other things that play into almost every disease process that's out there. And most doctors, they treat symptoms. You come in and you say, oh, my head hurts. And, I don't know if you've seen this like hilarious YouTube video, but it's like, this person has like a nail going through their head, and it's a woman, and her boyfriend is like, well, let's just get on with our day. And she's like, no, I got this bad headache. Well, take some Tylenol, take some aspirin. She's literally got this nail in her head. It's like, dude, it's not, you just don't mask the symptom. If you're sitting on a tack and your butt hurts, don't just take a Tylenol, get off the freaking tack that you're sitting on. I mean, it's crazy to, I mean, it feels ridiculous to even speak this way, but a lot of doctors only treat symptoms and they don't go a little bit deeper to what's the actual cause.
Going back, and we kind of dabbled into this in the last podcast. I don't want to go too deep into it, but just kind of going back to your previous point about these doctors just treating symptoms and not asking you those questions about eating, sleeping, relationships. The list goes on and on. Is this something that's taught in medical school, and due to the pharmacology that they're just sticking to these same medicines and just prescribing these same medicines for the same symptoms they get all the time?
Yeah, so definitely a lot of this has the root in the medical education. And sadly, I mean, I can speak to this because I went to medical school. I know what it's like. In fact, I went to a top 10 medical school, graduated top of my class, and we were not given great training in looking deeper as to root causes. We were trained really, really well in pharmacology, how a certain antihypertensive or a blood pressure pill, how it works, what is the actual mechanism? We have 3 or 4 types of them out there. Some are diuretics, some are what are called ARBs, others block certain alpha receptors. There's all different varieties of high blood pressure pills. And we were taught very well how they work on a physiologic level, but we weren't taught to really include in our thinking all of the other, what you might just call generically the environmental issues, right? We always ask the question, is it genetics? Is it what we were given by our mom and dad, or is it environmental? And the truth is, it's both. However, what was taught when I went to medical school, which is, I'll be honest, it was almost 30 years ago, what we were taught was that the genetic predisposition was super important. And not that it's unimportant, because it is, but actually present day, our understanding is that environment plays a much bigger role in almost all of the very common health conditions that we see today. In other words, let me give you an example. Heart disease, right? It's the +1 killer in men and women, not only here at home in the US, but worldwide. Heart disease is the #1 killer. And 90+% of it has nothing to do with genetics. Nothing. Over 90% of it is environment. It's what we do or what we don't do, the things that we eat or we don't eat, whether we move our body appropriately or we don't, or if we're sleeping well, or what kind of stress we're under. Like literally, the environment is more important than genetics, even in most cancer. And this is actually, it makes me really sad, because right now, present day, I'm struggling with this. Both my mom and my stepmom were diagnosed with end-stage metastatic cancer in the last year and a half. And I've watched them go through the traditional medical establishment, and they do lots of tests. I mean, they're looking at the genetic makeup, like what markers do they have and all these kinds of things, because they're looking for a targeted approach. Certain cancers do have some more targeted approaches, but they're failing to even consider things like diet. Which is crazy. Like there's lots of data on diet and cancer. There's a doctor by the name of Seyfried that has studied this his entire life. The dude's pretty old, and he's got lots of data on how certain diets, for example, like the ketogenic diet, can be really helpful in cancer and other things as well, which makes a lot of sense, but nobody is paying attention. They don't even look into that. And it really, it hits close to home for me, because doctors are largely doing what they were taught in medical school. And sadly, they weren't taught some of the most important levers to really not only treat, but also reverse disease. And these are the things that I love to talk about in my book, because they're simple things that we can do at home that don't cost extra money. And anyway, yeah, sorry if I was a little bit belabored on that response, but yeah, it hits close to home for me.
No, that was great. And, we have to talk about this because in the past 3 years, especially, we've seen a lot of trust in our medical establishment really go down the drain, and it's their own fault, unfortunately. It's pretty sad. And the healthcare system just gets worse and worse as years go on. And when they keep spewing that damn line on TV saying America's got the best healthcare system in the world, I just cringe with my life.
Yeah. Let me speak to that for like 30 seconds. So
Sure.
My training originally is I'm a board certified emergency doctor. I'm an ER doctor for a couple of decades. And so that's my specialty. And I will say, hands down, if you get in a bad car accident or you have an acute life-threatening, like here in Hawaii, we'll see an occasional shark attack or things like that. Like you got to go to the hospital. Like emergency care is really, really important. And actually in the US, it's really, really good. Our trauma care, the things that we do for those acute situations are extremely good. Even the acute care for a heart attack, right? We can go into the actual tiny little vessel in the heart called the coronary artery, and we can put a little balloon in there. We can inflate the balloon. We can bust out the clot. Like we can do amazing stuff. But what we don't do well is everything else, which is over 90% of all healthcare expenditures is in chronic disease management. Things like type 2 diabetes, high blood pressure, cancer, neurodegenerative illness like Alzheimer's, Parkinson's, dementias, and these kinds of things. That actually is over 90% of the healthcare dollars spent here at home in the US goes to all of that, which are kind of ongoing chronic conditions, which are largely they're almost 100% preventable. And that's where all our money's going because we do a terrible job at preventing disease, a terrible job. And so, as you know, that's why I even titled my book Preventable. And we probably don't have time to get into it, but when I first released it, it was up for 2 days, got bestseller in 7 out of 7 categories, #1 bestseller. And then it was pulled. It was literally pulled and you couldn't even get it for a couple of weeks because the establishment doesn't want to hear about how we can prevent disease. I was literally told that it was misleading to even state that disease could be prevented. My book was literally pulled for a couple of weeks. I had to go back and forth multiple times until we finally got it back online. And it's crazy. This is simple stuff. We're not talking about anything woo-woo or weird, like eating the proper diet, moving your body, sleeping well, how to manage and really optimize stress. This is not earth-shattering, crazy woo-woo stuff. Like this is simple stuff.
It's all about big pharma getting more money off these pills, off these vaccines. I won't divulge into that. We'll keep it PG because we'll get censored. I've been censored many times on these sites, so we'll keep it low key here. I do want to get into about detoxing the inflammation from the body. We talked a lot about, I believe in our previous podcast about eating correctly, what to eat, what not to eat. We talk about, fruits, vegetables, organic, stay away from these pesticides, the glyphosate, which is doing numbers on our body. That's a whole nother story for a whole nother ball game.
Yeah.
But regardless of that, what would be your truth telling to the people listening to, as far as detoxing this inflammation from their body and all these toxins from the environment or from the food we eat?
Yeah. So this is also a very old remedy. This is something we as humans have been doing for thousands of years, and it's called fasting, right? People do it around the world. They do it in every culture. They do it in every religion. They do it in every group of people that's ever known to exist. Even our predecessors, right? The hunter-gatherers, they had to fast when they couldn't find food. They might have to go days or even weeks without food. One of the body's most amazing, beautiful, and just surprising mechanisms to heal itself only happens when we fast. In other words, when we don't consume calories. And so there's lots of ways to do it. You can do, super agro 1, 2, 3, 4, 7-day fast, which I wouldn't recommend very often, but a couple of times a year to do a multiple day fast is super helpful. I've literally seen people cure their own cancer and serious health conditions with a prolonged fasting period. And this is what we would call like a water fast. So you can drink all the water you want. You can do all the electrolytes you want. You don't want to mix in electrolytes that have sugar, right? Sugar is the enemy to basically inflammation. And we've been talking about inflammation. One of the primary drivers right now, present day, 2023 of inflammation is sugar and all of its relatives. So this means wheat, this means gluten, this means any processed grains and flours, and any sugar that's not just the minute amount of natural sugar that you find in vegetables and fruit that, like you said earlier, that are organic, hopefully, and that are well raised and cultivated. That's okay. But any human-derived, man-made in a factory that comes in a bag or a box or with a barcode that has sugar or grains or any of these kinds of flours, that is one of the most inflammatory foods we could ever be exposed to. And so the quickest way to detox, to be honest, is to go on a 24-hour or a 48-hour fast. Most people could do 24 hours without too much trouble if they really focused on it. If you're on certain medications, obviously, if you're taking insulin and things like that, you want to discuss all these things with your doctor. None of this is medical advice, but one of the quickest ways to detox your body is through a fast. And what I personally do, I don't go aggro, with 2, 3, 4, 7-day fasts, except maybe about once a year. But what I do every single month, at least I do one 24-hour period of fasting. And I can drink all the water I want and be hydrated. I can even throw in electrolytes. And that makes it a lot easier for me to get through a 24-hour period, because I'm a high energy guy. I do multiple things for my fitness and exercise, and it's a little hard to do what I like to do without consuming any real calories. And so that's what a fast is basically consuming 0 calories. Drink all the water you want, have as many electrolytes as you need to. But I would start every night. This is something I think all the viewers and listeners could do starting tonight, is start with an overnight, simple, easy 12-hour fast. And it might sound daunting, but hopefully you're shooting for an 8-hour sleep. So before bedtime, one of the kicks to having the best sleep of your life is wait 3 hours after your last meal. So don't eat right before bed. Your body needs time to digest, and that will throw off your sleep. So try to go 3 hours before bed without eating food. You can drink a little tea at night or do whatever your evening ritual is, as long as it doesn't contain calories. And so 3 hours before bed plus 8 hours that you slept, you're already at 11 hours. Now, all you have to do is wake up in the morning and don't run to the refrigerator or the pantry or anything else. Instead, just drink a full glass of this beautiful H2O here. And that will probably get you through 1 more hour. And then you have a 12-hour fast right there. Simply, you don't have to do, all the in vogue right now is do intermittent fasting, right? Push it to 16, 18, 24 hours. Do a OMAD approach, right? The 1 meal a day. You don't have to do that. Do a simple overnight 12-hour period of fasting with no calories. And if you can't do that on the first night, totally cool. Start with whatever your sleeping time is and add 1 hour to it. Right? Do 1 hour before bed that you don't eat. And the next day, do 1 hour after, the morning when you wake up, and don't eat immediately. Try to go 1 hour without eating. And then you've already got a 10-hour fast. And then you just gradually improve that until you get to 12 hours every single day. There's almost no reason why you couldn't do a 12-hour fast every day, because it involves an overnight period where you shouldn't be eating anyway, right? If you get up to pee like I do, like I'm 50 years old, I often have to pee at night, which really sucks and annoys me because it busts up my sleep. Don't snack if you wake up in the middle of the night. Just go back to bed after you pee. Keep all the lights off. I keep a little headlamp at my bedside that's one of those red light lamps, so it doesn't mess up my vision. It doesn't mess up my clock. So I use the red light so I don't trip and injure myself going to the bathroom. And then I get back into bed. I don't check the time, never check the time, because that just plays games with your head. Just go straight back to bed, go back to sleep. So inflammation, the quickest way to get rid of it and to detox your body is through a fasting period. End of story.
I want to go into a quick question, audience question. First one, supplements. I have a nutritionist personally. We talked about her off air, that I trust her very much so. And she's been leading me the right way as far as eating and what supplements to take, because we all know our food is very diluted, not like it used to be. And a lot of these vitamins and minerals are taken out of the food due to bad soil, due to chemicals. The list goes on and on. Would you suggest any supplements for people listening to take?
Yeah. So once again, I won't get too deep into the weeds, but in my new book, Preventable, I literally have a whole chapter on supplementation, but there's some really big ticket items that almost anybody can benefit from immediately. And these would be things like omega-3 fish oils, for example, DHA and EPA, and they can be sourced from fish, from krill, from all different potential sources. But to be honest, like if there's any vegans or vegetarians out there, it's really hard to get this to an adequate level without some sort of animal product. You can buy algae oil and things like that give you some omega-3, but it actually doesn't convert, simply in a one-to-one fashion in your body into a usable and applicable DHA and EPA. And so you have to consume such huge amounts that I treat any patient in my practice, whether it be vegan, vegetarian, carnivore, omnivore, like I am, or anything. And what I've seen is that people that are strict vegans, they really have a hard time getting enough of this omega-3 into their diet, which is DHA and EPA. So a supplement is really great. Vitamin D, most of us are deficient in vitamin D, actually, and we saw this obviously through the pandemic. That was a big factor. People were getting more sick when their vitamin D levels were low. So vitamin D is another one that's a big bang for your buck. Magnesium, which is an essential mineral that most of us are what I would call functionally deficient. So if you just take a blood test and you look at your magnesium level, it tells you what it is in the blood. That represents less than 10% of the magnesium in your body. So it's not an accurate predictor if your magnesium is good or sufficient, I should say. And most people functionally, about 70% of us have a low level of magnesium functionally in our body. So magnesium is something almost anybody can benefit from. A good multivitamin that has what I would like to just, generically call an absorbable form of its nutrients. Like, for example, vitamin C, which is ascorbic acid synthetically, that's what's made in the lab. It doesn't work as well as vitamin C from a camu berry, which is natural, right? It's just not going to work as well. Or my favorite, folate. Folate is something we all need. In fact, it has been shown to help decrease the incidence of heart disease and other issues. And also, if it's a woman who's of a childbearing age and they want to conceive, like, they should be making sure they have enough folate. And sadly, even most of the OBs out there give them what's called folic acid, which is a synthetic version of folate, which is just not absorbed as well in the body. You know this, Rob, but I don't know if your viewers know much about the MTHFR different varieties that exist. This is a type of methylation pathway that a lot of people have variants. They're called SNPs, or single nucleotide polymorphisms, where they actually don't use folate as well as other people. And so they need to have a folate supplement. And the best one for them is certainly a more natural occurring folate, or one that has what's called a methyl group attached to it. It's called methylfolate rather than folic acid. It'll just make your body absorb it better. So look for a multivitamin that has methylated folate, methylated vitamin B12, which is cobalamin. And that's something that's often deficient in folks that are either vegan or vegetarian, because it primarily comes from animal products, vitamin B12. And I've seen a lot of deficiencies over the years. But if you buy the type that doesn't have a methylated form, your body just can't use it as well. So the big joke is, should I take supplements, doc? It's like, well, that depends, because if you just buy the one that's on sale at Costco, most of that crap you're just going to piss out because your body can't actually absorb it anyway. So you got to buy a high quality supplement. And the way I look at it, Rob, is I use it as part of my food budget. My supplements are included in my food budget. And yes, sadly, in 2023, we need supplements. I'm a food first guy. So I do everything I can to get everything I need from my food. But the food today is not the same as when we grew up, Rob. Like, literally, even the fruits and vegetables, even the organic ones that we're looking hard to find, they have less than 50% of the nutrients that they had 50 years ago when I was born. I mean, it's amazing how quickly this has deteriorated. It has to do with the way that we grow food, the prolonged storage time, the travel times. Literally half the crap you buy at Costco has been in a refrigerator for months before they ever put it on the shelf. I mean, anyway, I don't even like to think about that. It just annoys me, but you have to supplement present day. There's just no way out of it. If you want to have optimal health, you're going to have to supplement.
Dr. Thomas Hemingway, it's thomashemingway.com. The book is Preventable: 5 Powerful Practices to Avoid Disease and Build Unshakable Health. I just want to put the exclamation point on your last statement. So a person like me is taking magnesium complex, vitamin B complex. With those, is it better to take the complexes because you're getting all different of the Bs instead of buying, all separate ones? The magnesium, instead of buying all the separate ones that they're combined, as long as the company is clean and there's not all the fillers and all the junk that's in a lot of them.
Yeah, I would say that's great. But yeah, you definitely, like with anything else, the source matters. Whether it's third-party validated, both for potency and safety, really important, the third-party validation, because you don't have to do that. That's a problem with supplements, is you can literally, I could bottle whatever I want and start selling it on all kinds of, websites and say, this is Dr. Thomas's supplement. Nobody's going to check it. Nobody's going to see if it has what I say that it has. They're not going to check the potency, the safety, nothing. It's kind of like back in the wild west as far as the regulation or lack thereof of supplements, which is fine, but you as a consumer have to be savvy. You have to look at the label. It should be third-party validated, tested for both the purity and potency, but also for safety. Also that it comes from a reputable source that's not using magnesium from China or places that might be in question, things like that. So yeah, there's definitely some key concepts there, but I would agree that if you have a good source, it's a company that does all of these good manufacturing practices and everything else, that's gluten-free, that's, you know, not going to have GMO in their products and all that sort of thing, fantastic. There's lots of different companies out there that do a great job. And there's a lot of charlatans out there as well. So you just got to be careful. I'll explain all that in the book, how to pick an appropriate supplement. You're welcome to email or just look me up online, that's Dr. Thomas Hemingway on Instagram. I personally answer all of my messages. So you can reach out to me if you want to know the different brands that I personally use, you know, go for it. I'll be happy to share that with you offline.
Yeah, I check out the book, as we stated, Preventable, 5 Powerful Practices to Avoid Disease and Build Unshakable Health. I want to move into the SSRI aspect of the interview as we're moving towards the end. You know, I have trouble saying the dang initials. SSRIs are really prescribed almost like candy. It's almost like Oxycontin now, where you go into somebody and you tell them a little bit of troubles in your life, and they try to put you on this medicine. It's happened to me personally. I refused to take it, and thank God I didn't. Talk to a lot of doctors, and they talk about the side effects with suicide. Mass shootings are even linked to that now. There's a lot of things that are being linked to SSRIs. Why do you feel like they're prescribed so much, Doc?
Not to mention erectile dysfunction and any number of other things that can be caused by this lack of libido. And all young dudes like ourselves are going to care about that sort of thing. Women should care as well, and I think they do. But here's the thing. The original training on the treatment for these mood conditions, whether it be depression, anxiety, which are both treated, interestingly enough, with exactly what you stated, the SSRI, which is a selective serotonin reuptake inhibitor, is the mainstay and accepted treatment for both anxiety and depression. Why that would be, who knows? But the model that they used to describe this was actually based on bad science. And this dates back about 20 years. And this was recently come to light in a major way in that publication called Science. And for those that are familiar with it, it's one of the most well-known peer-reviewed journals in the world. They literally came out and showed the studies that these medications were based upon were basically all a bunch of BS and flawed. Like this theory, this selective serotonin reuptake inhibitor theory of depression is actually not backed by good science. So that's the first thing, right? But now that we know that, it's difficult because there's no quick alternative pharmaceutical therapeutic out there for this. That's basically, we hung our hat on this theory of the cause of depression, which was a low level of these type of neurotransmitters, right? Like serotonin and others. We basically hung our hat on that 20, 30 years ago when we first thought that we discovered it, and it was all based on erroneous science. So the trouble is twofold. One is the fact that they're one of the most popular selling medications worldwide. They make the top 10 every single year of billions and billions of dollars spent on that class of medication. What's cool, Rob, and you, I'm sure, know this, is basically you can take one of those medications head to head, compare it with my favorite therapeutic for having a little bit of a mood problem, is just go out and move your body and exercise. There's basically no study that shows that exercise is any worse than basically an SSRI or one of these medications for depressive symptoms. Like literally head-to-head exercise does as well, if not better, than these medications, and it's free. It doesn't cost anything. But that's not popular out in the world because nobody's making money off that. I mean, maybe a personal trainer, but not really. Nobody usually goes to them forever. They might go for a month or 3 months or 6 months, but then usually everybody kind of decides to just do it on their own. They're too expensive, whatever. And so there's no big money market for teaching people other ways to help, treat their depression, anxiety, whatever it is. And I'm not going to say if you're on an antidepressant, please don't stop it. Please don't stop it without discussing with your doctor, because some of them need to be tapered slowly. You can have side effects. But the bottom line is we now have data that shows that the whole basis for the treatment that we're using was flawed. This was a major issue. It came out of Europe. It was in Science, which is one of the most respected journals of all times. It came out within about the last calendar year. Rob can maybe give that in the show notes later, but it's crazy that we still, even after this study happened, we still prescribe them like candy. And the reason why, twofold. One, for the doctors, it's the easy button, right? Why would a doctor want to listen to everything that causes stress in your life? It might take 1 or 2 hours when they could bust out their prescription pad and within 5 minutes, you're out the door with a new prescription for an antidepressant that is prescribed and recommended for both anxiety and depression. And then he can go on to see the next patient, because the way that he or she is paid has to do with how many people they see in a day. It's volume. And so it's not that they don't care. It's not that they don't want to talk to you. I mean, they're just trying to survive. They're trying to get all the patients in and out so they can have some kind of, personal time when the day is over. And they were trained that way. To their credit, they are doing what they were taught. But the problem I have is most of them don't stay up to date with the literature. They go to medical school, they do their residency, they start working, and they're so busy and overwhelmed that they don't take the time to continue to read up on the newest data. And that's their fault.
Robert F. Kennedy, who everybody on here knows, I'm voting for him for president. That's why I stayed registered as a Democrat to vote for him in the Democratic primary in the state of Florida. Regardless of that, he's talking about that SSRIs, could be playing a key role, because a lot of these school shooters are having these depression thoughts. They're having the anxiety. They might be taking these SSRIs. If we have less people on them, we might have better outcomes of not having school shootings. He's also talked about, and I see this in small towns across America, that some of these kids, they have gun clubs at their schools. They bring their rifles to school when, this is 20, 30 years ago. Some even still have it. But in that time frame, they were bringing the guns to school. There was no school shootings. There was no one blowing up schools. It was just a regular sporting activity like hunting in general is. What is your opinion on SSRIs? And do you feel like they could play a role in these type of school shootings? I mean, obviously, we could look at video games, movies, the list goes on and on, but I'm just talking about one aspect of the puzzle that this could be with kids.
Yeah. So I will answer that in 2 parts. I think the short answer is yes, they could be partially I hesitate to use the word responsible, but they could definitely be involved with that. And this is something that's well known. Anybody who studied the literature on this type of medication, the SSRIs are well known, especially acutely, which means in the first several weeks to months that somebody is taking them, well known, almost all of them will cause increase in suicidality and symptoms in the first several weeks and months. This is well known across almost every type that is out there. Sadly, most people don't know about it. The doctors rarely tell their patients about it. And yet it is something that's been well known since inception, since these things were first available. So that's number one. Second point is that because, as we talked about just a few minutes ago, they're prescribed so quickly without actually taking much history, taking much time to really figure out why the person is having struggles with either depression or anxiety or what else. They just press that easy button because it gets the patients out of the room quicker. I can just give them a prescription for an antidepressant and everybody thinks that I'm doing the right thing because, they have depression. They should be given an antidepressant, right? It's just science, right? That's how they were trained in medical school. So they press that easy button. And what they failed to do is they fail to actually dig a little bit deeper to find out what may be actually at the root of these things. And for me, it's a struggle because, for example, I might see somebody in the ER. I still do shifts in the ER, and they might come in, either having done something to try to kill themselves, or they have a plan that they want to hurt somebody else. And this is serious, important stuff, but it's rare, even in my line of work, that people ask them, like, tell me a little bit more about what's happening in school, what's happening in your family life, your relationship life. Like, I get it. Like, it takes more time to do that. But when you just press that easy button and you give somebody an antidepressant, whether it be an SSRI or one of the other classes that all have been shown to potentially increase suicidality as well as aggressive behavior in the short term, that you're doing them a disservice. Because who knows, like you said, if they're going to get that side effect where they all of a sudden, have the desire to act on some thought that they might have had in their head to go harm somebody, this guy or gal at school that's giving them trouble. And then they just open fire on a bunch of people because they got this, tendency, maybe I'll call it that, from the new SSRI that they're on. So absolutely, it could definitely be involved. It is multifactorial for sure, but I think it's a disservice that many doctors prescribe them so easily, willingly, and without really taking the time to dig a little bit deeper. It's a big problem.
Dr. Hemingway, you put up a podcast on June 9th about dieting and that how that's obesity's biggest problem. Can you give the short version? I do hope people, if they want to listen to the podcast, Unshakable Health, Dr. Thomas Hemingway, all your podcasting locations, definitely listen to the full conversation. But just for the viewers here and the listeners, just talk about that subject that you talked about early on in June.
Yeah. So, yeah, the short story is we have been over focused, hyper focused, really, on all of these, dozens and dozens of diet, plans, strategies that exist. And present day, Rob, sadly, we, especially here in the US, it's well documented, we are the fattest, the most overweight we have ever been in the history of Homo sapiens, in the history of our kind, our species. We are more overweight today than we have ever been at any other point in history. And yet we have access to dozens and dozens of diets out there. Sadly, they share a commonality. And this commonality is that every diet, no matter which one you pick, has some way that they are counting calories, right? Because we all were taught that it's calories in equals calories out. All we have to do is lower our calories and move our body more, right? Eat less, exercise more. Well, that's not quite how it happens in the body. The whole way that this was designed, and it's super interesting. I wish I had the book, but the original book was by Dr. Lulu Hunt Peters in the early 1900s. She wrote a book on dieting. It was a #1 bestseller for many years. And even back then, like at the turn of the century, 1910 or 11, something like that, she sold over 1 million copies of this book. It was how to diet. And the focus, even in that time, was on calorie counting. Calorie counting simply is not the answer. It's really about the food quality. It's about the timing of your food. It's about what macronutrients you're choosing to eat. Like, we got this all wrong, Rob. Back when we were kids in the 70s, we were told we couldn't eat any kind of animal fat because cholesterol and animal fats is what, that's a so-called saturated fat. They cause heart disease. End of story. That's what we were told. Well, guess what? That's completely wrong. But what happened was they substituted all of the fake butters, all of the quote, vegetable oils for natural things we used to cook with. We used to cook with lard. We used to cook with bacon grease. We used to cook with butter. And then we start using all these fake spreads and all these oils that were designed in a laboratory, that I'm not saying that the people who designed them were trying to hurt us. They just maybe didn't know, but it just got off the rails. And we still use this calories in, calories out sort of dogma. And every nutritionist you talk to present day, they're going to talk about calories in, calories out. And I'm just telling you, here's a simple example. I tell this to my kids. 1 cup of broccoli, it's actually more than a cup, is, although it's equivalent to about 1 Oreo cookie, the same amount of calories, they are nothing alike. They don't look alike. They don't taste alike. They don't have the same nutrient profile. And although they may be the same exact amount of calories, everybody can understand and appreciate that a cup of broccoli is not the same as an Oreo cookie, and they shouldn't do the same thing to your body. And guess what? Big surprise. They don't do the same thing to your body. The Oreo cookie causes tremendous inflammation, which is really at the heart of every disease out there. Whereas that, cup of broccoli actually is anti-inflammatory, has nutrients in there that will help get your immune status up and also boost your liver, right? Broccoli is amazing at helping the body to heal, but they have the same amount of calories. And if you use the traditional dogma taught in almost every dietary plan to count your calories, you're going to be led astray.
Last 2 questions. And first of all, I always love hearing what you have to bring to the table. I think it's important for people to listen and watch these conversations, especially with you for that matter, because, and I'm not trying to BS you or, get you all excited, but what's true is true. I've seen a lot of doctors in the past 3 years, and you tell it straight. You don't sugarcoat it. And I think a lot of people, whether it's politics, whether it's medicine, people want to hear the real deal Shaquille O'Neal. They don't want to hear some fake, phony BS that they've been getting every day from mainstream doctors, mainstream news. So thank you for doing what you're doing and talking about this. As we talk about the last few questions, it seems like there's now a vaccine for everything. RSV, monkeypox. Now they're looking at a cancer vaccine. I saw that on the Today Show. I don't really watch that program, but I was somewhere where they had it on, unfortunately. And then obviously there's the COVID vaccine. With that said, should we be worried that it seems like they're just trying to make you take shot for this, shot for that? And I keep being told that these shots, obviously, like any medication, have some sort of adverse effects. Some people, yes, some people, no. We'll play it even with that. But also, a lot of these shots do hurt your immune system, which we've heard with the COVID vaccine.
Yeah, so it's an interesting, and this is also part of that response I gave a little while back. Part of it really is we're looking for the wrong thing, right? We're chasing our proverbial tail, if you will. We're looking for an answer where it doesn't really exist. And part of it is just the easy button, right? Who wouldn't want a vaccine that would make our life easier? And in times past, there's been lots of vaccines that have helped society tremendously, right? Basically, smallpox is an example where it was essentially eradicated due to a vaccine. Also, polio, for example, was essentially eradicated. And to me, this hits close to home. My stepdad has a gimp arm that he can't hardly use because he got polio as a kid, and it made it so he's effectively got only one functioning upper extremity, and thank goodness, he taught himself how to use that one really well. He's a left-handed dude, and his right hand is essentially worthless. And that was because of polio. So there have been vaccines that have been really helpful over the years, but I would say nowadays, the impetus to develop vaccines is not the innocent, let's try to keep people from dying in childhood diseases because this could be prevented. It's now the impetus is twofold. One is how we can treat or cure things that we don't want to treat or cure in other mechanisms that are more time consuming, take more effort. Like,
well, they're not lucrative. It's not a lucrative.
I mean, let's just state the obvious. There's billions and billions and billions of dollars being made on vaccines each and every year. Like I have kids, I have 6 kids, and they've been to the pediatricians over the years. And it's very interesting how the thought process has changed with respect to vaccines. Like the amount of vaccines that are on that quote unquote vaccine schedule that's recommended for children today is almost 10 times what it was when I was a kid. It is ridiculous. Like you said, there's a vaccine for this and that and the chicken pox and now all these other things. And they're saying a vaccine for cancer. Well, they make a lot of money. I mean, they're among the biggest revenue returners of almost any kind of pharmaceutical in the world. They make billions, trillions of dollars, including, the recent one for, the COVID, I mean, it's crazy how much money is being made out there with vaccines. And so I think it's that problem, which is the obvious, you just follow the money, but it's also it's our problem as humankind to not want to do the real work, right? We want easy. We want to take a pill for stuff. We want to just get a vaccine for stuff because we don't want to do the work. The cool thing actually is that you can live super healthy, vibrantly, and it actually isn't a lot of work. It's just a change in your mindset and in your lifestyle. Like I love eating great food every single day. I love to travel, Rob, because when I go places, like I sample the local cuisines and it's amazing. Like my plate is so full of different varieties, colorful things, and it doesn't have to be hard. It doesn't have to be hard, but we have to decide right here and there that we are not victims. We actually get to take charge of our health. That's the whole nature versus nurture and the new science of what they call that's above epigenetics rather than just genetics, which is that, whatever we get, we just inherited from our parents, which is really less than 10% of it. So we have to take charge ourselves. But the answer to your question is twofold. One, follow the money. I mean, they make lots and lots of money and it's the easy button. And so we have to change that, people like you and I.
Well, there's also talk of making every vaccine mRNA now. My story on that. I'm not going to get sensitive and go into it, but we'll leave that there. I'm not playing that game again. And then second of all, they're talking about even making vaccines out of food. I've heard this with vegetables. I mean, we already have it. We already have issues with food. I mean, we don't need more contaminants with our food than we already have. I'm not going to put you on the press for that, but we'll move on. That's just my opinion. People can think different. We're not telling anybody to not get any vaccines. If you want to get as many vaccines, get 10, get 20, get 100. Load
but
your
do your
whole
homework.
body up.
Yeah,
Yeah.
do your homework. I mean, be an educated, we can just call it that, an educated consumer. Don't just blatantly follow the masses, because the masses aren't always doing what's best. You just doing your own homework. I respect everybody's personal choice. I mean, I'll be honest, I've vaccinated a bunch of my kids because I didn't know any better. I simply didn't know any better. It was what I was taught in medical school. And I think a little bit differently now because I consider all the information we have. And I would just, ask that people do their own research and really don't be blinded by whatever's mainstream. Mainstream doesn't mean it's the best thing.
The talk is that people, men and women, younger and younger, are getting, these diseases. You spoke about heart
Yeah,
disease.
yeah,
I'll
yeah,
talk about colon cancer, breast
yeah.
cancer, any kind of cancers. They're getting this younger and younger now. So, for instance, my family, my father had, colon cancer. I'm 33 years old. For somebody like me, when should I worry about looking into this? Because again, people like myself that really care about their health rather, that really are doing that research, that are trying to eat correctly and live a good, healthy, long life, and some people trying to beat illnesses that they were dealt. With that said, how do we stay ahead of the curve here if we have family history or, just to be safe in general for that matter?
Yeah, so all of what you said is correct. The incidence of cancer has dropped. In other words, younger people are getting cancers present day. Also, the quantity, the sheer numbers of people getting cancer today in 2023 is much higher than it was 30 years ago. And some people will argue, oh, well, that's just because early detection. We find it
No.
sooner. BS. That makes up some of it. Of course, it makes up some of it. We have better screening, but people were not dying by the droves of colon cancer, breast cancer, all of these types of cancers that we are seeing regularly today. Like everybody I bet that's listening today has a relative. I myself have both my mother and my stepmother present day are being treated for metastatic cancer. And that wasn't the case when I grew up. I don't even think I knew anybody who had cancer, to be honest. And now everybody has somebody close to them that's being treated for cancer. One of my best friends just last year was diagnosed with stage 3 colon cancer. And he's my age. He's young. He shouldn't be having colon cancer, but it's happening at earlier rates, primarily because we are not living an anti-inflammatory lifestyle. This has to do with diet. This has to do with our sleep. It has to do with our exercise, all of these things, because if you consider the populations that predated us, let's go back even, 100 years or so, people didn't eat the kind of garbage that we ate today. They mostly did manual things. Everybody had a farm. They grew their own food. They were working in that farm every single day. They weren't sitting on a chair, right? We all know that sitting is the new smoking. The more we sit in a day, the more our chances of cancer go up and every other disease go up when we're sitting on our butts all day long. We got to move our bodies more, like, duh. We know that, but it's also all the other things, right? It's all the exposures. We didn't used to grow crops with glyphosate. Now every crop has some degree of glyphosate. Even the organic ones, they have a little less, but they've been tested and they've been shown to have glyphosate. Unless you personally grow it in your own field and you know everything that's happened in that field, and there's no neighbor of yours that's spraying glyphosate, that it might get, a little bit of the wind carrying it into your property, your yard or whatever. Like it's tough. It's tough. So there's a lot of factors. I would say close to home, the easiest one that's within your control is just what you choose to eat each and every day. And also your behaviors, right? Whether you're moving your body, sleeping well, managing your stress. But it's super sad because we're missing the target. We're looking for a vaccine to cure cancer. We're looking for, all of these detection techniques. Oh, let's sequence the genome of the cancer and see, well, guess what? If you sequence the genome of 2 cancer cells that are right next to each other, guess what? They're different. They're literally right next to each other and they have different makeups because of this thing called mutation. That's the changing of genes. And so we're missing the target. We need to go back and do things simply and naturally like we used to do instead of trying to overcomplicate it. Healthy living, Rob, does not have to be complicated. It really does not have to be complicated. And that's why I wrote this book, because it doesn't have to be complicated. It can be simple.
I listen to Dr. Drew. I think he's good, but you are America's doctor, and people should listen to this podcast, buy the book. I hope they really do. Like, no BS, because this country's in deep trouble. There's a lot of people dying at earlier rates. Just
Yeah.
to put the exclamation point on that question, quick answer. So somebody that has, one of these diseases in their family, if they're in their 20s and 30s, when should they think about, getting tested, whether it's a Cologuard
Yeah.
with
Yeah.
colon cancer
Yeah.
or some other test for, breast or health,
Yeah.
heart
Yeah, no,
cancer?
definitely. I'm all about early detection. I'm not going to say, don't get tested, especially if you have a family member that's had earlier diagnosed, whatever it may be, breast cancer, colon cancer, whatever the case may be. Early detection is critical. So, in your case, you would be getting a colonoscopy sooner than somebody else who doesn't have a family member that ever had colon cancer. So early detection is important. And my friend who's my age, he found out, he didn't even know he was sick. He found out he had stage 3 colon cancer only because he had a completely routine colonoscopy. And he got his colonoscopy like he was supposed to at 50 years old. And it showed stage 3 colon cancer. He had no freaking idea. So don't run away from your doctor. Don't not get a test done because you're hearing that we're entertaining other things like natural remedies and things like that. Of course, we need to use the tools that are available to us. Early detection is critical, but beyond that, there are other things. Let's say you get a screen, Rob, and the thing is negative. That's awesome news. That is perfect, but that doesn't mean you should go out to McDonald's tomorrow and celebrate, right? I mean, come on, we still got to eat the right foods. We still got to do the healthy behaviors because cancer is largely preventable. And one thing I just want to put the final, punctuation mark is that present day, not only are we the least healthy we've really ever been, we're the most overweight we've really ever been. And the data all show this, even the CDC's own data shows this. This is nothing that should be new to anyone, but also I think most people may or may not know this, but our own mortality rates as humans, we present day are dying sooner than ever before. In other words, this is even predating COVID. Like forget the pandemic. It didn't help us live longer, but even before that, our life expectancy had already started to go downhill, even before COVID, a couple of years prior to COVID. And guess what? It keeps going downhill each and every year. This is the first time in at least the last 100 years where our kids will live less long than you and I will. And it's largely from preventable causes, things that we can do something about. So that's what I want our listeners and viewers to go away with tonight after hearing this, is that there is so much you can do. You don't have to be a powerless victim that just listens to your doctor and says, take this medication, take that medication. There's, quote, nothing else you can do about it. BS. There's much more that you could do about it. We need medicine. We need doctors, but we need better trained doctors. We need doctors who are willing to read the current research. We need doctors that are willing to take the time to listen to you and what's happening in your life. Not just taking the typical 5 to 7 minutes, and that's enough time to give you a prescription, but it's not enough time to dig a little bit deeper and to figure out what's really underlying a lot of these illnesses. So you may have to fire your doctor, maybe not today or tomorrow, but you may have to consider getting a new provider that's willing to look outside the box, that's willing to actually listen to you and what you have to say, and that you can work with as a team member. Health is a team sport, but guess who's the captain? The captain is you. It's not your doctor. The captain is you, because at the end of the day, you have the most control over your own health. The power lies within you. It's a beautiful life. There's so much you can do, so go after it.
Extremely well said. Again, ThomasHemingway.com, preventable, 5 powerful practices to avoid disease and build unshakable health. We need to do a podcast on that book soon, within the next month or so. But regardless of that, Unshakable Health also with Thomas Hemingway. That's the podcast. Doc, thanks so much. Appreciate you coming on as always.
Hey, always a pleasure, Rob. I'm glad that we had this chance. It's always great to chat. I'd be willing to come back at any time. And just thank you for the opportunity, and a big aloha to all the viewers out there.